The surge in COVID-19 cases is now impacting contact tracing investigations in Nevada. A memo obtained by 13 Action News from the Nevada Department of Health and Human Services recommends disease investigators cut back on the number of questions and information that they collect from people with COVID. And 13 Action News reporter Astrid Mendez now shows you why these changes are being made.
COVID-19 contact tracing does not start until there is a positive diagnosis by health authorities. And investigators say that the fact that there are changes in the questions does not mean they're not doing their investigations. As the number of COVID-19 cases continues to rise, the Nevada Department of Health and Human Services is asking those who do contact trace investigations to scale back the amount of questions they ask of those infected. State health officials say the surge in cases is hurting the ability to keep up with contact tracing. Brian Levis, epidemiologist in charge of a UNLV group of investigators, says that contact tracing works best when a disease is under control, which is not the case here in Nevada.
We have limited resources. We can't do a 2-hour-long investigation with every single person who's positive. So we have to sometimes dial back the questions that we're asking, the less important ones. Not that we won't bring them back up as we get on top of things more, but if your system is at the risk of being overwhelmed, we can reduce the length of those interviews so we make sure we get a little less information, but from everybody who's infected.
Some of the questions that are not being asked anymore include if you have visited a casino or if you work at a hotel or as a food handler.
If you happen to work at a casino doesn't mean you were infected there. So we could ask about what all those exposures are, but we don't know which one actually resulted in you getting the disease. So that's why those things don't have as much value as people think.
However, other questions besides knowing who you are and if you have any pre-existing medical conditions are still part of the investigation.
We also want to know who you've been around when you were infectious. So not just looking at where you got it, but who you could have given it to as well.
For all this information to be gathered, health officials say that it's important people with COVID-19 answer them into quarantine to avoid future exposures. Astrid Mendez, 13 Action News.